Right. So, as I say, first thing we're going to go onto Microsoft Studio, and then we just select Administrator, which gets us into the software. Now the next step is, so this opening screen here, we can do a couple of things. We can either select a previous participant, so if we've tested somebody before and we want to test them again, we can select them here. And then you can either just select them as a person, and then click the type of test that you want to run, and then press next, and that will allow you to do another test on that person, so it sort of saves you the time of entering their details and things. You can also, if you like, press the down arrow there, and then it will show you previous tests that you've conducted on that person. And what you'll see is if I click on one of those, the options now change in the left hand side, and they change to analysis options, so I could go back to a test and do some analysis. But for us, what we're really going to do is just go to new patient. It's always going to be a different person for each test, and then our test is the NTU Lab 1. So once we've selected those, we click next. Right, and then in this screen we are just going to focus on the stuff that's over here on the left hand side, the administrative data. So what we're going to do is we're going to give you an ID for this test. So it's going to be EHP, Exercise and Health Physiology. You are group 9, so it's G9. This is bike number 1, so bike B1, and then you are subject 1 on this bike. So if you come in next time and you do another test on this bike, on this setup, it'd be EHP, because it's still this module, it'd still be group 9, it'd still be bike 1, but then it'd be subject 2. Alright? And what we're going to do is we're going to take that and then use that as their last name and first name, just so that the data are anonymized, so that next time if someone else does come to this computer in a year's time, month's time, whatever, they might be able to access the information about you, but they won't know it's your data. So that can be quite important if you think about it, because it's going to have information about your fitness status, which is a predictor of health and mortality rates. In a different scenario, it might have information about your ECG recordings, which can tell you about heart conditions and stuff. So it's ideally, if you don't need to take somebody's personal data, you shouldn't do, and you should try and anonymize. We are going to put your sex down, and then what we're going to do is we're going to put the first of the first and the year of your birth, so we've got kind of the right age, but not the date of birth. So what's your date of birth? 2001. Do you know your height?
Yeah, 170.
170. Can I get you to just slip your shoes off and just go and weigh yourself on the scales over there for me? Well, I'll just select your mask size. Okay, so then we click next, and that takes us through into the next screen. So in this one, we've got two things we're going to do. We're going to calibrate it. We're going to calibrate the machine. We do that because it's quite sensitive measurements that we're taking. And so whereas some machines you might calibrate it once a week, once a day, these need to be calibrated for every test that you're going to conduct. So the two calibrations we're going to do, the first one is a flow sensor calibration. So we just click over here. Now we're going to do, we're going to do sensor adjustment first. So sensor adjustment, and then we're just going to click in the top right hand corner here, start sensor adjustment. And all that's going to do is it's going to start drawing air into the system. And it's going to analyze it for its fractions of oxygen and CO2. And basically what it's doing is it's kind of saying, we know that in the atmospheric air there's 20.93% oxygen. So it's dragging that air in, and then it's sort of weighing up that when it senses that particular kind of reaction, if you like, because it's kind of a chemical reaction, is it thinking that the value that it's getting is 20.93? Because if it's not, and it's higher, it needs to make some adjustments to its calculations. So that's what it's doing now. It's running it through and it's saying, do I think this is 20.93? And if it is, then good. If not, then we're going to have to do something about it. So it's happy with that. So the next one we're going to do is a flow sensor calibration. Now the flow sensor calibration is kind of looking at the other part of the equation. So we've just looked at the fractions of gases and calibrated for that. Well, now we're going to calibrate for flow. so to check that the turbine's working okay. Now to do this, we take this 3 litre syringe, so it's been calibrated to be exactly 3 litres, and all we're going to do is connect it up to our syringe, to our flow sensor, and then we're just going to plunge it in and out. And essentially all we're doing is we're mimicking inhalation and exhalation, and it's doing the same thing. It's expecting to get 3 litres of air exhaled, 3 litres of air inhaled. If it thinks it's getting something else, like 2.8 litres, it needs to make an adjustment to its calculation. So all we do is we press start, and we see this little red line running across. Now as I pull the plunger in and out, you can see that line goes up and down. Now the faster I do it, the higher the spikes, the lower, the slower it is. Now the most important thing when you're calibrating this is that you go to the end of the plunge each time, because it's expecting that 3 litres, it's calibrating to 3 litres. And then if I go fast, if I go too fast, it's not going to calibrate because it wants to know it's getting 3 litres, but it also wants it at a certain flow rate. So what I'm going to do now is I'm going to slow that down so that like the inhalations and exhalations fall within that purpley pink box. So now I'm calibrating it for volume at a particular flow rate. What you can see from the figure there, so you can see the blue and the orangey bars. What you can see is that the blue bars are slightly higher than the orange ones, aren't they? Which is interesting because obviously I plunged 3 litres through both. But what it means is, relative to one another, it thinks that the exhalation is higher than the inhalation. It thinks that both are slightly higher than 3. So it's going to make an adjustment for that. It's going to do something to its calculations now, so that when you're on the back and you're breathing, that it knows that if you were to breathe out 3 litres, that it would sense that accurately. Right. So once we've done that, we're happy with that now. We've calibrated the machine, it's made its adjustments, and now we're just going to select the type of test that we want to run. So fortunately, the test that we're going to run is very similar to this kind of stock test that's here. So we're going to do a 3 minute of rest, so the pink one here. We're going to do 3 minutes of unloaded cycling as a warm-up, so the brown one. We're then going to do our exercise bout, which is a ramp test, which is what this is set up to do. And then we're going to go into a recovery phase for 3 minutes. Now the only additions or changes that we need to make is this exercise phase here. Well, first off, we don't want it to start at 50 watts. So if we move this up and down, it changes the starting point of it. We want that down at 0. And that's just so it matches the patient population and what I did with them when I tested them a few years back. And so the next question is, like, how quick do we want our exercise to ramp up? So what do we want the ramp rate to be? So it could be as high as 50. So that means it goes up 50 watts for every minute, or it could be as low as 5, meaning it only goes up 5 watts per minute. So can you think about what factors might play a part in us deciding how high we have this ramp? Well, yeah, so fitness, definitely. So if you think someone's going to have a higher VO2 max, you think it'll be higher or lower? Higher. Yeah, okay. Why is that though?
Because if they've got like a lower VO2 max and increase the power per minute too much, then they'll just equal.
Yeah, perfect. Yeah, absolutely. So what we're trying to do is we want to try and have a 10-minute test. And we want to have a 10-minute test because that allows us to kind of isolate the aerobic system being the limiting factor for the exercise bout. If it's too short, then things like muscular endurance and aerobic capacity are going to play a part. If it's too long, then probably things like motivation and maybe even substrate utilization and things like that might have a part. We're not interested in them. We're interested in someone's aerobic capacity. Yeah. So what we want is a test to be about 10 minutes in duration. And therefore, for someone who's fitter, we're going to have to make it harder, quicker than someone who's less fit. Yeah. So is that an also body mass? A bigger person, you would expect to be able to produce more work, and therefore you probably account for that as well. So my patients usually sat between about 10 and 15 watts per minute. So what do you think, like how fit are you at the minute? What sort of exercise do you do?
I say I'd probably do like 12 or 13.
Well, my patients are 10 to 15 watts, and they were like 8-year-olds with heart failure. And
easy. I go for runs like 4 times a week.
Okay. Let's put you on a 30 watt ramp.
Ah,
Let's
okay.
see. So look, the point is, like you might be under that, you might only be able to do, so the way to think about this is to go, how many watts do I think they'll be able to produce? Because if I'm sort of saying that I think you might be able to get towards 300 watts, because that means that if we've got a 10-minute test and you get to 300 watts, that puts you on a 30-watt ramp, doesn't it?
Yeah.
Yeah, because every minute you're going to go up 30 more watts. Now look, if you're only able to do 250, it means you'll have a 8.5 minute test. It doesn't matter. All we want is it somewhere between, say, 6-7 minutes and maybe 13-14 minutes, really. That's kind of like the ideal. So it doesn't really make too much of a difference. So I'm happy with that. So then we go through to next. And then this is our opening screen. So what I'm going to do is, why don't you pop this heart rate monitor on? So if you wet the two sides of it there, and then put it up near your chest, then all I'm going to do is I'm going to adjust this slightly, just to put a bit more information on. So I'm going to click over on this grey bar, and I'm going to add a time to the display, just so I can keep a track of what time we're on, so I can explain to you what we're going to do. And then I'm going to also find work rate, and I'm going to click and I'm going to drag that over into this top right hand panel. And then the last thing I'm going to do is I'm also going to put work rate in here, and heart rate over here. And that's now my opening screen. So whenever you're ready and we've got you set up, all we need to do is just come over here, press the play button, and it'll start collecting the data. Right. We've got a few bits we need to do before then, but right. So what I need you to do, you need to get your mask set up. You have a mask facing that way, that looking like that, on the outside. All you're going to do is touch your nose, top left, top right, click it and pull back, top left, click it and pull back, and that's ready to go in your head. It's over your head and clips underneath. Right. So you can do that. Take it out of the back. Bottom there. Basically, that's your top, that's your nose. Circle goes in there. There you go. That's it. That's it, and you put it over your head. Still, before you do that, so what you need to do is, this is a filter. Fortunately, you can get the exact size to fit the two parts that you've got. So what you need to do is take this tape, wrap it around the smallest part of it, about 8 times. Okay, do that before you put the mask over it. So, all you need to do, you just bring it over here, and just see if you can fit it into that there. Too easy, so if you, at least another wind, maybe another wind round, just to make it a bit tighter. Yeah. Perfect, quite tight. So Look, don't push it in too far just because this needs to go. So you're fine. Turn it over. Perfect. Okay. Right, so stay there for the time being. So if you put your mask on for me. Yeah, you take your mask off. Yeah. It'll only be for a minute because you'll have the filter in a second. Yeah, take that. That's it. Put it down a bit. Have a look at your heart rate monitor. Put a little bit higher for me. Right, that's it on the back. I'm just going to adjust it for comfort, so you can just let me know if you think it's to go higher or lower or handlebars closer further away.
That feels alright.
Okay, done. I've got gloves on, so
That's all right. Stay there.
just a man push it. All I'm going to do is just take this. Right, so just resting straps to start off with. So, stay as you are. Right, so we're good to go. So the test is going to run like this. 3 minutes of rest. So you just stay there, you don't have to do anything. And then after 3 minutes, I'm going to ask you to start cycling. When you start cycling, what I'd ask you to do is to get your revs per minute, so your cadence, how fast you're turning the pedals over, between about 60 and 70.
Yeah.
That might feel a little bit slow for you, but it matches what we do with the patient, so it means you're keeping it consistent. And then after 3 minutes of cycling against no resistance, so this warm up, you're going to feel it start to, we're going to increase the work rate, so you're going to start that ramp. And the ramp sort of feels like you're going up a hill that gets steeper and steeper and steeper. But for the first 3 minutes, maybe 4 minutes, you'll feel really easy. You'll have about 2 or 3 minutes where it feels like moderately, like nice, and then for about maybe 2 to 3 minutes, it'll start to feel difficult. Importantly, the test doesn't end when you get to 10 minutes. It doesn't end when you get to a certain wattage. It ends when you feel like you can't turn the pedals around any longer. Okay, so it's a maximum exercise test. What I'd ask you to do is join the test not to speak, because every time that you speak, it changes the values that we see, because it alters the variables, because it changes your ventilation patterns. However, if you need to stop for some reason, if you feel unwell, or you just want to stop because you don't want to do it anymore, then that doesn't matter. That overrides the idea of not speaking. Just let me know, we stop the test and put you into recovery. Okay? Any questions? Excellent. Right, we'll start the test then. So what I'm going to do just while it starts to kick into gear is I'm just going to take your oxygen saturation. So it's the only additional thing that we need. The machine's going to measure your work rate, it's going to measure your heart rate, it's going to measure your ventilation, all of these things. But we haven't really needed to do externally, we need to measure your O2 sats. Now all this is doing is it's kind of estimating your arterial oxygen saturation. So that is the percentage of your hemoglobin molecules in your arterial blood that are saturated with oxygen in comparison to those that are not. And you'll tend to find that it sits in and around about 98% in healthy people at sea level at rest. Okay, so I'll show you over there. Let's settle down a little bit. So 97, so perfect, absolutely fine. And we're just going to put this down here. This SpO2 box, 97, and set. What we're going to do is we're going to measure that at peak exercise as well. So we're looking to see whether that changes, and then It's another variable that we can use to compare with our patient populations. So what I'm doing now, as I'm testing, is I'm looking to see whether these variables are as I would expect them to be. So VO2 you can see is at 0.35 litres per minute, which is where I thought it would be. VE is maybe a little bit higher, but it's not too crazy, kind of maybe a slight bit of hyperventilation. That would also be reflected in your RER being slightly higher than I would expect, but not crazy, kind of in and around where, you know, it sort of matches what you're doing with your VE at the moment. And I'm doing this because whenever you're performing tests like this, you've always got to make sure that the risks of doing the test are outweighed by the benefits of doing it. So the benefits of doing it, like in a clinical scenario, might be to understand more about somebody's health, so you can help, dictate their level of care. But there is a risk to it as well. So what I'm doing now is making sure that this is working properly. Because if it's not, I don't want to be getting an 85-year-old, lady who's got cancer and some degree of heart disease doing a maximum exercise test when I'm not going to be able to use the data to help her care. Right, okay, so we're coming up to 3 minutes. If you can start cycling from remembering to try and keep your reps per minute between about 60 and 70. There's not much to look at this phase of the test. I suppose I'm really just seeing whether things move in the right direction. So is oxygen consumption going up as I'd expect? So you often see it kind of almost double during unloaded cycling. So you're about 0.3 at rest, you're going up to about 0.6, 0.7 during this unloaded cycling phase. And then you're seeing kind of like similar changes that you'd expect in your ventilation, so your VE, and then also your heart rate. And just to go through the screens, so what we've got here is like this screen here in the top right is really just displaying like the overall metabolic response to the exercise. So, how is work rate going up? How is that being matched by your increase in oxygen consumption? This panel here, we're looking at like cardiac variables, so heart rate, and then this thing called oxygen pulse. So heart rate sort of self-explanatory, but oxygen pulse is kind of an indicator of stroke volume. And so this is kind of like a cardiac panel. Top left-hand side is just simply VE over time, so I suppose a respiratory panel. Just underneath that down here is another respiratory panel, so this is looking at the VE VCO2 slope, so how much does your ventilation need to increase relative to an increase in VCO2 production, CO2 production. Next one down is like the pattern of your ventilation, how that changes. So you've got VE here along the x-axis, VT, so tidal volume, the depth of your breath on the Y, and then basically you're going to sort of see the pattern of your ventilator response to try and achieve a greater VE. So how much are you achieving an increase in VE due to an increase in depth of breath or due to an increase in the frequency of your breaths? We've got RER, which is going to tell us about your in some instances this type of substrate that you're using, but also how much of an impact anaerobic respiration is having to your overall energy production. Bottom right, we've got these things called end-tidal partial pressures of oxygen and CO2. They're being used to estimate what's going on in the arterial blood. The middle right is ventilator equivalents for O2 and ventilator equivalents for CO2. And they're being used again as markers of respiratory efficiency, if you like. How much do you need to ventilate for a certain amount of CO2 produced, or how much do you need to ventilate for a certain amount of oxygen consumed? And finally, in the middle, This one is called the V slope, and it's looking at the relationship of oxygen consumption to CO2 production. So now you're in the sort of first phase of the ramp, so you're going to start to feel it. You'll barely feel anything for the first minute or two, and then you'll start to feel a little bit of an impact of the watts, making the exercise a little bit harder. So one of the key points we're trying to get across in this lab seminar is understanding the order that things are influenced during one of these ramp tests. So sometimes when I've asked people in the past, like, why might oxygen consumption increase, or why does somebody have a higher oxygen consumption than somebody else, often people think it's to do with ventilation. They'll say, oh, it's because they're able to ventilate more. And it's the wrong way of looking at it. It's kind of looking at it backwards almost. And what you can see with this test, like developing in front of you for your own test here, is exactly the order that things work. So if you look at the green line there, you see that's representing your work rate. So that's perfectly linear because it's being increased by 1 watt every couple of seconds. So that's the first step, the way to think about it. So what's driving everything? Well, the first thing that's driving it is how much work you're doing. So as you're required to do more work, your body needs to respond. So what we can see is just above the green, we've got the blue. So and the blue represents your oxygen consumption. So the way to think about it is, if I need to do more work, then I need to resynthesize more ATP. Now we don't measure ATP, unfortunately, but that's a step that's missing, if you like, between those. And the amount of ATP that you need is directly proportional to the amount of work that you want to do. Right? So if you want to double the work, you're going to need to double the amount of ATP resynthesis in order to be able to do that work. And similarly, if you want to sort of resynthesize more ATP, the most efficient way of a long duration exercise is to increase your oxygen consumption, aerobic respiration. So you can see that that's matching in a fairly linear fashion to the work rate. So it's more work, more ATP, more oxygen consumption. But one of the bits that's often missed by undergrad students is that you can see that as oxygen consumption is increasing, so is the red line, which is CO2 output. That's because you're turning some of that oxygen into CO2 in order to liberate that energy to resynthesize your ATP. So it's not exactly a one-to-one relationship, but it's kind of fairly similar. So it's increased work, increased oxygen consumption, increased CO2, and then if we flick over to this other figure here, it shows you what the next step is. So what this is showing you is this beautiful linear relationship between the increase in CO2 and the increase in ventilation. So we've gone increased work, increased ATP turnover, increased oxygen consumption, increased CO2 output, and then this part is showing you that as you increase your CO2 output, your VCO2, you are increasing your VE in a linear fashion. And so for you, you're approximately increasing your VE by about 25 litres per minute for a 1 litre increment in your VCO2. So it all matches up, and that's the order. So when you ventilate more, you don't ventilate more to use more oxygen, or you don't use more oxygen because you can ventilate more. You ventilate more because you're increasing oxygen consumption, increasing CO2 production, and CO2 drives your ventilation, and that's the order that you should be thinking about it. Doing really well, good job. Right, the other point that I was just getting across, because it relates to assessment, it comes back to the same figure, is, as I just said, when you go from 1 litre per minute of CO2 output to 2 litres per minute, you increase your ventilation by about 25 litres per minute. So that means you've got a 25 to 1 relationship, 25 litre increment in VE for every 1 litre increment in VOCO2. So you can represent this whole figure by saying that the slope of that line is 25, and that's known as your VE VCO2 slope. It comes up a lot in the literature for heart failure and COPD. And what happens in heart failure and COPD is the line's steeper, so their value is higher. So for them, they may have a VE/VCO2 slope of 40 or 45. It's going to go in this direction. And what that tells you is that their breathing is less efficient than yours, because they're needing to breathe, say, twice as much to clear the same amount of VCO2. So COPD, heart failure have higher VE/VCO2 slope, indicating impaired ventilatory efficiency. So you're doing a really good job. Keep it going. Keep going, doing really well. Oh, good man. Well done. Right, so you're going to go into recovery now. The weight's off the pedals now, so just spin your legs over. It's going to feel really easy. Well done. And then we're just going to take your 2 sats again. Feeling okay? Good job, well done. Okay, so your sats are the same, so they've not changed at all. 97,